vetting to begin. Well, it has started actually. So let's take you now live to Parliament. Here you see in your shots Joseph Osei-Wusu, who is chairman of the Public Accounts Committee. We're expecting that they'll be vetting the National Security Minister-Designate and some other ministers-designate. Do stay.
I have observed that, notwithstanding Mr. Speaker's strict instructions, members have already defied the COVID protocols. The distances that were kept, for which the Ghana Health Service has posted a person here to ensure we comply with. Those who are supposed to sit at the back have joined in.
They should be spraying us
well, the sanitizers are spraying left and right. I hope it is sufficient for us. But they are coming to install another one to ensure that members are safe. But please, let's do well to observe the protocol. Honourable members, before we proceed, let me announce that we have a number of supposed petitions. We'll consider them in respect of the Honourable Minister for Health. What is before me, which I received last night, is supposed to be a petition from his former driver. I've read the content. It has not passed the mark of the petition, but if any member wants to ask questions relating to what is the content, I'll permit that. So before we proceed, I want you to understand that for those that are of substance, we'll consider them and take the appropriate decisions before we deal with the nominees. But let's start with prayers. Honorable Samsiahi, we are already on air, so we'll hold our meeting subsequently. So kindly let's start with prayers.
So, Mr. Speaker,
yes.
Even though, not to challenge the Speaker's or the Chairman's ruling, if there are other petitions that you have received but you have not mentioned, will then be permitted for people to draw your attention to it?
Yes.
Okay.
No, but Chair Speaker, but as you observe, I think tomorrow, before sitting, there must be a pre-sitting meeting to consider all the petitions in its entirety. Then we as a committee can determine the substance, merits, or otherwise of the weight of those petitions as a collective. So if you can tomorrow, leaders, that would be useful. Thank you, Chair.
Exactly. Honourable members, let's pray. Almighty God, we humbly beseech thee to look with favor upon this Parliament of the Republic of Ghana. Grant that it may perform its high duty as in thy sight. Give divine guidance to the President of the Republic. Thou members of Parliament and Ministers of State with discernment and vision, integrity and courage, that through the labors of government, this land and people may be well and truly served, and thy good purposes for the common human life be realized in our midst. O God, grant us the vision of our country, fair as it might be, country of righteousness, where none shall wrong his neighbor, country of plenty, where evil and poverty shall be done away with, country of brotherhood, where all success shall be founded on service and honor shall be given to the deserving, country of peace, where government shall rest on the will of the people and the love for the common good. Bless the efforts of those who struggle to make this vision a living reality. Inspire and strengthen our people that they may give time, thought, and sacrifice to speed the day of the coming beauty of Ghana and Africa. Amen. Kindly bring the nominee in. Kindly administer the oath.
I, Kwaku Agyemang-Manu,
swear by the Almighty God.
Swear by the Almighty God.
That the evidence I shall give before this committee.
That the evidence I shall give before this committee.
Touching the matter and issue.
Touching the matter and issue.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
So help me God.
So help me God.
Honorable Kwaku Agyemang-Manu, on behalf of the committee, we congratulate you on your nomination as the Minister for Health. This is not a new portfolio for you. You've held this position for the past 4 years. But the Constitution requires that at the end of every government, a new one starts. And so for us, it's a new position you've been appointed to under this government. Now, you will take us through your CV. And if you have any questions on your CV, we'll ask you. And then we'll ask you questions relating to your position as Minister for Health. So you may please start.
Thank you, Honorable Chair. Honorable Chair,
Honorable, kindly wait. The ranking member will make his opening comments before you start the CV.
First, Deputy Speaker, Chair, and colleagues of the Appointments Committee, understandably, we are meeting under your chair as a committee to examine the President's nominees as was forwarded to Mr. Speaker. I note that this is a shared responsibility under Article 78 of the Constitution, that the President shares the obligation with Parliament as an institution. Mr. Speaker, it is my considered view that we use this opportunity, the 8th Parliament, to set limits for the President and future President on the size of government for Ghana generally to protect the public purse. What I find striking is that in the President's nomination, and this for purposes of national unity and recognizing the diversity of our country, the Upper East region and the Uti region are conspicuously lost in the long list of 27 ministers so far communicated to 30 ministers so far communicated. We don't find any representation from the Upper East region and from the Uti region. For purpose of national unity, I'm sure the President should take some clue as we begin this important process. And Mr. Speaker, to assure you that we are not here to undertake any act of witch hunting. We are here to examine the records of ministers, their fidelity with the law, and to hold them accountable to the people of Ghana in accordance with facts and law. So thank you for this opportunity, and to welcome the Honorable Minister for Designate to the committee hearing. I thank you.
Very well. Honorable Minister-Designate, you may now take us through your CV.
Thank you, Honorable Chair. Honorable Chair, I've mentioned my name already, but I may wish to repeat. My name is Kwaku Agyemang-Manu. I was born far back in 1955 on the 6th of September at Domahinkro in the Bono region. Hometown, Domahinkro, again in the Bono region. I'm a Christian, married with 6 children, a Ghanaian. I speak Bono, let's say, Cree and English, with a little bit of French that can help me find my way through the streets of any French-speaking country. I started my lower primary school at LA Methodist Primary School at Okrakrum, a village situated on the border between Bruno and Northern West at the moment. I moved from that place when my mom relocated from the farm to the Domahinkro Township, where I did the upper primary in Methodist Primary School. Then I went on to do my middle school education at the Methodist Middle School, again in Domahinkro, and I ended up in Doma Secondary School, where I did my O-levels. Honorable Chair, after O-levels, I moved to try to do some little adventure, and I came to do my 6th form school at Presbyterian Secondary School, Legon. From there, I got enrolled to the University of Ghana, where I read and attained my bachelor's in 2 subjects. Those days we call it double honors, in economics and statistics. I sojourned, I moved to London, later in life, where I qualified as a management accountant, tutored from the London School of Accountancy. I did my national service as Excellency Secondary School in the current Ahafo region. I taught mathematics and economics, both 6th form and O-level classes. Then I moved from there to join the then National Bureau of Statistics. Currently, the name has changed to Ghana Statistical Service. A very short period, within a year, I was made head of prices, where I was in charge in computing price indices and submission of this data to the UN. I left there again for adventure and joined the Sokoto State Education Service. I was a teacher in there for nearly 4 years, and I was teaching economics again and mathematics. Whilst there, I started trying to become an accountant, and I joined the Chartered Institute of Management Accountants as a student. I did the foundation stage examinations at a go, 2 parts in Kaduna. After I passed, I did to try to do the professional stages again in Sokoto, but communication at the time wasn't advanced. Postal services were not very good. So by delays, I decided to go to London to do my courses. When I finished in London, a record time qualification, I joined a furniture company, Rich Wells, where I served the company as an assistant management accountant. About 4 years from that time, I moved down to Ghana again, and I joined Mim Timber Company Limited. That is in Ahafo region, as a deputy chief accountant. About 3 or 4 years from then, I moved to a company that was dealing in Toyota vehicles. It was a state-owned company, Gamut Company Limited. After 3 or 4 years with them, the company was diversified and name changed to Toyota Ghana Limited. I continued to be there until former President Kufuor won the elections in 2020. 2000, then he nominated me to come and join his government as a deputy minister. Over 8 years, Honorable Chair, I served in nearly about 5 or 6 ministries. Ministry of Transport and Communications, Ministry of Roads and Transport, Ministry of Finance and Economic Planning, Interior, Trade and Industry. That is where I ended. All this while I was outside Parliament, but helping to try to run the country. I joined Parliament, my constituency elected me as an MP in 2009, January sworn in, and I represented the Doma West constituency at the time, which is now splitted into 2. So we now have Doma West, and then we have Doma Central. Honorable Chair, in the House, I was made the Vice Chair of the Public Accounts Committee initially. Then after 4 years, when I got re-elected as an MP again, I became the Chairman of the Public Accounts Committee. After that, 8 years in opposition, where I was chairing this committee. I party won elections again, and the current president, Nana Kwaku Agyemang-Manu, called me for the position of Minister for Health. I came through the Appointments Committee and passed through my vetting without much problems, and have served in that capacity up till the time the Parliament closed. I got re-elected again, and luckily for me, I'm thankful to the President. He has nominated me again for vetting to take the position of Minister for Health.
I think you can, the rest we can look at them, but other members are open the floor now, can ask questions relating to his ministry, his work in other places, and his competence. Yes. Yeah. Yes.
Thank you very much, Mr. Chairman. Mr. Chairman, I raised some objections to hearing the nominees this morning on air and on our platform. I want to put the issues before the nominee to get his take on them. Is he familiar with the Presidential Transition Act of 2012, and in particular, sections 6 that deal comprehensively with handing over notes? And it says, and with your permission, let me read, Mr. Chairman. The office of the President shall prepare a set of comprehensive handing over notes covering the term of office of the President as the executive authority under Articles 58 of the Constitution. The notes prepared under subsection 1 shall include the handing over notes received by the President and the ministers on assuming office, and B, notes on the activities of Roman numeral 2, the ministries, departments, and the agencies. And the handover note shall reflect the accurate developments which have taken place during the tenure of office and the projections of development to take place before the end of the full tenure. 7 says, the Administrator General shall make available to the person elected as President the original copies of the handover notes. 2, of the 5 other copies, the Administrator General shall retain 1 copy, and 1 copy shall be sent respectively to Parliament. Are you familiar with this, and have you submitted handing over notes in accordance with this
Honorable Member,
Transition Act?
Honorable Ayaga, I want to say on record officially that the Administrator General has transmitted the presidential, the handing over note to Mr. Speaker, officially. So whatever issues there are, we can take them with Mr. Speaker. I kindly ask the nominees questions relating to other matters relating to his work. If one is knowledge of that law, that's fine. But certainly the part to do with the Administrator General, I'm aware, has been done.
Mr. Chairman, so, Mr. Nominee, will it be appropriate to say that your handover note reflects comprehensively the work that you have done as a Minister for Health for the past 4 years?
I will say yes, Mr. Chairman.
So I requested for the handover notes. I was on air. My chief whip tried severally to get copies of the handover notes for your ministry. After so much work, it was only this morning, Mr. Nominee, this morning, that I was given these 2 bound volumes as handover notes from your ministry. It is not your fault that I'm getting it now, but it's also not my fault that I'm getting it now. And I have a mandate to assess you, and you agree that handover notes reflects your achievement for the past 4 years. Will I be fair and right if I request that I be given at least 48 hours before I can proceed to vet you?
Member, that question is not fair to him. If you want to request that, you put it here. But please ask him, once it's before you, questions relating to his ministry. If it's going to be helpful now, if not, we'll proceed. But certainly, the time to allow you is not up to him.
I'm not asking him to give me the time. I'm asking him whether he thinks that it will be fair for me to be given that time. If he doesn't think it should be fair, then I can proceed. When I want to ask for the time, you are the one I'll ask for the time. But I'm asking whether he thinks that it is fair that I be given the time. If he thinks it's not fair, yes, it's personal opinion. I can ask him for his opinion about fairness.
Honorable Chair, it will be very difficult for me to give an opinion at this time.
I take a position, Mr. Chair. Yes, my third question. I take a position, Mr. Chair, that given that I have just been given the handing over notes, I'm unable to vet him on his performance for the past 4 years without the benefit of studying comprehensively his own report on his work for the past 4 years. And if, as chair, you are not so minded to give me that opportunity to study his report, I have already said publicly that automatically it means that I withhold my vote for him before this committee. If you are deciding today on him, but if you are not deciding today on him, then I request to be given that opportunity.
Another question, can you please proceed with the question?
Mr. Chairman, I've asked my questions. He has answered some. He has said he's not able to answer one. And I'm saying that based on the answers, I'm making a statement to you as chair and the committee.
I think when we meet, we can consider your statement. But for now, let's do the consideration with a member, please.
Yes.
So if you are done now, give the chance to another person, please.
Now I have a concluding question.
Very well.
No, I'm entitled to 5.
Please, we agreed on 3.
On 3.
3 per member, please.
Mr. Chairman, at the last meeting,
honorable members, please, there's no controversy. If there's a need for follow-up, we may consider. Please. Because we'll not change the rules at this time. You are fellow member, you have one more.
Chairman, I thought at the meeting
sitting, yes, you said substantive 3, but we said a member will be entitled to 2 additional supplementary. That was the understanding.
Honourable members, supplementary is not additional. It may
We agreed to.
Yes, Honourable Ayaga, please conclude.
Chairman, I just want to say that it is through no fault of his, in all fairness, that I don't have copies of, or I don't have copies of his statement. No, I don't have a copy of an electronic version of his ministry. No, I don't have it. It's through no fault of his that I don't have it, in all fairness to him, but also through no fault of mine that I don't have it. And I'm starting for the records here that if you insist on deciding on his nomination today, I will vote against it.
Honourable.
Mr. Chair, grateful. Honourable nominee, congratulations. My question is, you recall when the central market was burned down? Yes, that's the central stores. When the central medical stores were burned down, and the Global Fund lost some $27 million. Now, you know, government should have refunded this money. And however, the Global Fund entered into an agreement with the states to undertake certain activities to enhance the supply chain of the health sector. Are you able to tell Ghanaians the current state of the agreement entered into? Thank you, Chair.
Yes, Honourable Member. Your microphone. Please, will you attend to him? His microphone is not working.
Okay, we are on.
Thank you, Honourable Chair. Honourable Chair, I inherited this agreement that has been entered into between Ghana and Global Fund. Global Fund is an organization, a global organization that supports countries to fight malaria, HIV, and tuberculosis. At the time when the central medical stores got burnt around 2014, 2015, they lost commodities just like my colleague mentioned. The agreement had actually been summarized.
Chairman, I'm sorry to interject. Whip. He said loss of 21 million. You are now using your words to say commodities. So clarify, was it loss of cash? You have said loss of commodities. Loss of what?
Honourable Chair, loss of health commodities amounting to $27 million. The agreement was actually summarized into milestones. And what the state agreed with Global Fund was the fact that instead of refunding, undertake these activities. If you finish any of them, you will come and do benchmarking, and then we'll forgive you some portion of the loans. When I joined the ministry in 2017, Honourable Chair, none of the 4 milestones had been achieved. We're supposed to do a warehousing strategy, a very good one. We're supposed to do what they call framework contracting for procurement of commodities to be stored in our warehouses. We're supposed to do logistics management information system. And then the last one none of them had actually been done. So I took it upon myself to try to meet these targets.
I'm sorry again, we are following you clearly. You've mentioned 3. The last one you didn't, so give us the 3. You said 4 activities, 4 milestones, pre-works, logistics. The last one, you used the word last one. We want to hear what the last
logistics
activity was.
Contracting.
And Chairman would demand that a copy of that contractual agreement be made available to this committee for further perusal for our work. I thank you.
Honorable Chair, I'll make it available, but not at the moment. The final one, I just get my memory, Mr. Chair, but I think as we proceed, I'll be able to come up with that. By close of last year, the last one is the last mile distribution, Honorable Chair, said that we do our last mile distribution. Honorable Chair, by close of last year, we had virtually achieved all these, with the exception of the Logistics Management Information System. Even that one, Global Fund has actually contracted to support us. Information package that is being installed in all our facilities to monitor the distribution of our health commodities and the use. I expect almost all the $27 million have been forgiven. We left just about 1.2 to sort it out with the Global Fund. If we are not able to get the approval for forgiveness, then the state will have to reimburse Global Fund for the last bit of $1.2 million. Thank you, Honorable Chair.
Chair,
I said I will make available a copy of that contract.
Very well. The office will take note and pursue it for it.
Chair, I wish to further find out from the honourable nominee the inequitable distribution of healthcare staff to deprived areas or deprived parts of the country presents itself as a challenge. I wish to know from the nominee what innovative leadership style are you going to employ if you are blessed to be given the nod to assist the country to get over this challenge.
Thank you, Honorable Chair. I have actually started engagement with the professional associations of the health sector to try to find a solution to this particular challenge. It's been long overdue, and the problem is a bit complex. It's not very simple and easy thing. Luckily for me and for us, the country, a foundation called Clinton Foundation, just close to the end of last year, gave an indication of their support to hire a consultant to help us do our engagement and see how we can craft that one, said that it will enable us to submit a good proposal to Cabinet for approval for us to implement and see how best this problem can be resolved. So it is work ongoing, and if I get a note from you, honorable members, honorable colleagues, that is one thing I'm going to tackle as quickly as possible. Thank you, Chair.
Chair, I'm sure the nominee will agree with me that as minister, you inherited some 13 months debt from the NHIS. And as you sit here, claims have been paid up to September 2020. Correct me if I'm wrong, but if you take into consideration the statutory 3 months lead time of reimbursement, you have 2 months arrears. Do you foresee this development sustainable?
Honorable Chair, the answer is yes and no. Sustainable to the extent that we continue to get releases from the Minister of Finance, as has been given to us in the last 4 years. If that happens, then I would say we'll always have resources to be able to meet our reimbursable expenditures from the facilities. If that doesn't happen, it is likely we may go back to the same old problem of accumulating arrears that will hamper the efficient performance of the health insurance system. That is why I'm saying it is either yes or no. But for health insurance, I must be honest to tell colleagues and the whole country that costs for healthcare continue to escalate. But premiums that we pay to health insurance has been stagnant for a very, very long time, since the time we started. And if you look at actuarial studies, financially, these schemes that we are running, if we don't find a way to bring in some extra resources, either through increments in premiums or through more government resource allocation to support the schemes, going forward, we might not continue to see a sufficient performance as it is. So that is why I can say about this sustainability. But I foresee that it's a very good program that should continue to run in this country. And therefore, all of us parliamentarians will have to put whatever efforts we have to make to enable the executive or government to continue to support the schemes. Thank you, Honorable Chair.
Honorable Minister, you talk about premiums, but I know that health insurance has two components: the premiums paid directly, and then the SNAIT contributions, as well as what is paid on services. So which one do you expect that we should increase to be able to make the scheme sustainable?
I would say both the levy and premiums that are paid by individuals.
What about the SNAIT part? Is that sufficient?
The SNAIT part invariably is a small component of the entire health insurance resource. And since SNAIT is part of people's pensions, I would like to say, if I become part of those who make that decision, I will fight and advocate that we don't touch the SNAIT component at all.
Chairman, since the nominee is an economist, increase the levy by what margin? And does the releases from the Ministry of Finance to the NHI include bonds, to your knowledge, bonds?
Thank you, Honorable Chair. It includes bonds because there were debts without money sitting in finance to pay. The areas that was left for us to inherit, Honorable Chair, we didn't have money that was supposed to come from finance. So the Minister of Finance couldn't use current levies to pay for debts. That levies are collected and probably reallocated somewhere else. That is why the Minister will have gone for bonds. It was part of our suggestion because we needed money to ensure that health insurance continues running.
You know how much bonds have been issued to the National Health Insurance Authority?
Faint memory, I'm not very, very sure. We're close to about 400 million Ghana cedi. I said I'm not very, very sure. I can actually cross-check and give you the exact amount.
Honourable members, let's get the rules clear. I called for the notes to be clear. 3 questions clear. If there's a need for follow-up, it should be from the answers. That's why I'm stopping the Chief Whip from asking another question. Yes, Honourable Samson.
Thank you very much, Mr. Chairman. Mr. Chairman, in one of the broadcasts to the nation by the President with regards to COVID-19, he said the President promised that his government was going to construct 88 district hospitals. And then on the July, when the President met the chiefs and elders from Bolgatanga and Bongo and Talensi, the President was specific that those 88 hospitals was going to commence in July 2020. We are in February 2021. Can you tell this committee how many of those 88 hospitals have been built so far? And where, if you can mention those districts to us.
Thank you, Honorable Chair. That was the President's vision, which was supposed to have been translated into action. Seriously, the President set machinery in motion. He set up a committee in the presidency, chaired by the Chief of Staff. I was a member. We pulled 1 or 2 infrastructure directors from my ministry, Ghana Health Service. There's also a fair representation on that. What they asked us to do immediately was to write to district directors for health services. The local government minister was to write to all these assemblies for them to allocate land and give us the site plans of where they wanted these districts' hospitals to be sited. As I speak, we still have close to about 13 districts that have not completed that exercise. Some of the districts, after we got the initial responses, there was a team that was set up. A coordinator has actually been appointed to coordinate this because the work volume is so huge, such that added on to our ministry's work in the midst of COVID would have meant that we wouldn't move at all. So they sent teams into various zones of the country that have been divided by the coordinator and the team that is working on these 88 hospitals. Some of them have litigation matters, and so we have to find a way to settle them. We are still working on these, and contracts have been awarded, and we are waiting to do proper sword cutting for all these things, actual construction to start. The preliminary works have actually been done. We are not waiting for the ones that have been submitted and finished with land issues, but we've started working on them. We face challenges in the midst of COVID. Things were not moving the way things should have gone. And that is why you will see we might not have started serious work on any of them. But our target was to have at least reached length level by close of the year. Unfortunately, we couldn't get there, but we are working seriously on this matter.
Mr. Chairman, this is a follow-up. Nominee said that what the President said was his vision. But I've said to you that in July, the President was specific that the project was going to commence in July. So how can commencement now becomes a vision?
Honorable Chair, what I said was that President vision that should have been translated into action. And that translation gave us a roadmap. And that is how come the President said we'll start in July.
Mr. Chairman, thank you very much. Can you tell this committee how much it will cost to construct one district hospital and the total cost for the 88 districts?
Mr. Chair, the initial costing was done on the basis of averages. And we're looking at between $5 million to $7 million per hospital. On the issue of equipment and other logistics came in, other equipment came in, we were still thinking that a maximum $7 million could do what we should do. If you multiply this by 88, and the 88 has even changed to 111. We're adding on regional hospitals for regions that do not have regional hospitals, especially the 6 new ones, plus the Western region, the Northwest, Southwest region. And then we are also rehabilitating Ifeanyi Hospital. This, together with other places that we left out when we're counting this without hospitals 88, have brought this number to a total of 111 at the moment. That is what we are working on. If you look at the minimum 5 million and the maximum 7 million multiplied by the numbers that I've mentioned, take away the regional hospitals because they may come at a different cost. This is what it is. when the team went round, topography of land and all that is indicating that prices might not be uniform across the country. In some places, there may be some escalations. In some places, it might be probably lower. So we are still computing, and unfortunately at this stage, if I can tell you exactly how much the total will be, it will just be an estimate of what I've said. 5 times 111 minimum, 7 times 111 minimum. That is what I can say, Honorable Chair, for the question.
Chairman, just a follow-up. So if I did a little arithmetic, 7 times 101, do you have that on budget? Is it budgeted for? Will it be budgeted for?
Mr. Chair, definitely without a budget, we cannot utilize the money. And this question, I think finance will be able to actually put in. To the best of my knowledge, there is a provision, and finance has assured health that they are sourcing and have achieved some portion of sources that will do the work. So I wouldn't be the most appropriate person to answer this budgetary question, Honorable Chair.
Yes, Honorable Secretary.
Thank you, Mr. Chairman. Mr. Chairman, now that the COVID situation is becoming alarming and the numbers, affected numbers is increasing, the minister is aware that there are some regions that do not have ICU facilities as we speak. What are you doing to ensure that those regions, when they need that services, they will be able to get it? Because I know that Western North, for instance, don't have ICU, OT region don't have, have region don't have, but they are supposed to benefit or enjoy such facilities. In the absence of ICU, what are the immediate steps you are taking to ensure that those people are catered for?
Honorable Chair, at the onset of COVID onslaught in the country around March last year, the first instructions went from Ghana Health Service and the Ministry to all these hospitals to create spaces to fight the COVID battle. Honestly, these hospitals have never had intensive care units to the level that can take care of COVID, severe and critical COVID patients. So we kept on referring to the regional and how do I call it, the teaching hospitals. In the midst of that, after having evaluated the inadequate infrastructure in our facilities, we earmarked about 12 places where we set up ourselves to actually begin to construct treatment centers very quickly for us to be able to put in things to do the type of work my honorable colleague is asking about. Places like Zebila, Goso, Sefi also, I think somewhere in Soy also. The Dudua one is fully completed. Several places that we earmarked. Fortunately, the monies that were supposed to have utilized through the World Bank thing almost all went into procurement of PPEs, sanitizers, and face masks, and gumboots, and caps, and gowns for the doctors, and all that. So the project halted a little bit. It is only now that the second tranche of the World Bank support is giving us room to actually advance monies. We ask the contractors to pre-finance, and we will come on. And I believe by close of this year, all these treatment centers will have been completed. But we continue to rely on our referral systems to try to see how best we can solve the problem. Luckily for us, the enhancement of the ambulance service with 307 ambulances, one for each district, seem to be supporting us a little bit, and we'll keep on getting patients referred in ambulances coming close to where we have these facilities. That is what I can say in respect of this question, Honorable Chair.
Thank you very much, Honorable Samsahi. Yes. Is that Honorable Member for Juso? Okay.
Thank you very much, Honorable Minister nominee, and congratulations. I wish to thank you for your efforts in the handling of the COVID-19 pandemic. At a point, you had to sacrifice by being infected with the disease in line of duty. And of course, it's a sacrifice. And you are doing all this for the country. I want to find out how prepared are we as a nation for if another pandemic is to strike. What do you suggest that we should be doing now in readiness to prevent a future pandemic in terms of our readiness in handling of such matters?
Thank you very much, Honorable colleague. Honorable Chair, we were just about finishing the zero draft of emergency response strategy that will have eventually dovetailed into establishing a proper CDC in this country when COVID strikes us. So all those experts who were working on this strategy, including myself, had to put that one in the back burner to begin fighting the COVID pandemic. When the pandemic started slowing down and we thought that things were stabilizing for us, we were revisiting it, and then all of a sudden the upset that we have now. But that is a very big priority on the agenda if, Honorable Chair, you and your colleagues give me the nod, something that we're going to tackle seriously to get a fully established CDC in country before the end of the year when I get my note. The draft strategy is ready, and all I'll have to do is to do some more stakeholder engagement. I'll bring it even here to the committee for engagement, and we will look at it, pass through cabinet, to come here for us to actually see it before it goes through. But I'm very committed that we will see a CDC established in the country before the end of the year. Thank you.
Mr. Chairman, one key problem in our country hospitals is the lack of beds, the no-bed syndromes. And I know that as Minister of Health, you have made a lot of efforts to address this problem. But unfortunately, this problem still exists in many hospitals across the country. If you are given the nod, what will you do to make sure that this problem is resolved?
Honorable Chair, we continue to invest into equipment into our facilities. Not very long ago, we were given some resources to have procured 10,000 hospital beds that we have distributed equitably across the country. Again, we are working on deploying e-health electronic systems that has a component that does bed management in the facilities. So that in the very large facilities, you might see some beds empty in one department, and then emergency will be full. So we can see through quickly, and reports from the system will give you an indication of how to resolve that matter. But in the meantime, we've given instructions. There are no facilities to turn anybody away on the basis of no bed syndrome. We should find a way to keep the patient, to stabilize the patient before we begin to look at where we can conveniently transfer that patient to rest. So that is what we are doing. I believe that going forward, we'll continue to find resources to put in investments to help us resolve this matter.
Finally, Mr. Speaker, one of your key achievements as Minister of Health that you've been commended for is the introduction of innovation, drones, into our hospital services. I want to know from you how the deployment of this drone is impacting on our health systems.
Honorable Chair, one significant thing I may want to mention is the recent floods in northeastern region after the Bagri Dam was opened, as even some parts of upper east region. Because of the drones that we have installed, several places you couldn't reach. So we were flying essential medicines with the drones to these areas. Prior to that, you will have seen people carrying drugs and their vaccination fridges on motorbikes in water, crossing these rivers to reach heartlanders. But some parts of the country are now covered. We have installed 4 centers that is helping us do the work that we should do to reach people who are in very hard areas. Now, during the around October, I have been touring the country and looking at facilities and trying to motivate our health workers with my presence. There was a day we went to do a sword cutting for a chip compound to be done at Drobonso, the health center. Whilst there was a problem in there, and then they have ordered the drone to bring some oxytocin to try to support hemorrhaging in a woman in labor. And the drone came at a function where we had a function, dropped the thing, and the cheers that were coming from people there gave an indication that the deployment of these drones have been very useful to this country. And as I speak, they are helping us with the immunization program, flying vaccines to areas where we can't easily reach. And I believe when we begin to do our COVID vaccination campaign, these drones will also be useful to fly some of these things. And their capacity, they even have cold chain storage capacity that will enhance our existing capacity to be able to store our vaccines in there. Thank you.
Just a little follow-up to Honorable Ejisu. Minister-Designate, in your answer to his earlier question, you indicated your directive that no patient be turned away for lack of bed. You know that the doctors and nurses can carry patients even if there are no beds, and therefore it creates an obligation. Has it been brought to your attention that some COVID patients have no access to beds, and then there's critical shortage of oxygen for COVID patients in the country? And what are you doing about that?
Thank you very much. What I would say, in a pandemic of this nature, you will expect that the facilities we have would definitely not be adequate. Even in very developed systems like America and the US and Germany, this type of situation you are describing is found even there as I speak. We try to improve on the situation. Last 3 weeks or so, the new infectious disease center that we got support from the private sector fund to do for us, we linked the oxygen in the Ga East place to that. But when numbers began to rise up, we realized that that capacity couldn't do the 100 bed here and 130 bed here. So quickly we had to do emergency thing. And we have installed a new oxygen plant even in that area to work on it. As I speak, our engagement with USAID is bringing in a number of these oxygen plants to be sited. Yesterday, the memo I read through after engagement indicates where we have actually located some of them. We are saying that they should relocate them. WHO is giving us oxygen cylinders as we also strive to procure some more. And we are working very hard to try to see how best we can solve this problem. Now, the pandemic will give us some experience. And if we don't learn from this, and we continue to live our system the way the pandemic came to meet it, then it will not be a problem of only the health minister and only the current president, but posterity and all of us in the country. Thank you, Honorable Chair.
Yes, Honorable Okudzetabla.
Most grateful, Mr. Chairman. Mr. Chairman, I would want to begin by making a few preliminary observations. The nominee will have to help the committee with the accurate rendition of his name, because the communication from His Excellency the President, number 14, Minister for Health, Kwaku Agyemang-Manu, is spelled with a J, Manu not hyphenated. Your CV has Agyemang without a G and is hyphenated. For our records, which one do we go with? The communication from the president or your CV?
My CV, Honorable Chair.
I hope, Mr. Chairman, that the presidency will reconcile these matters. The CV you have submitted to us this time around, I have cross-checked with what you submitted to us 4 years ago. And you may want to look at the Hansard of 27 January 2017. Quite a number of your dates and numbers do not quite add up. So you may want to reconcile that later. Matters to do with your basic education. 4 years ago, you told us 61 to 65. This year is 1960 to 1963. And all the way down to London School of Accountancies. The years are not matching. And you may want to reconcile that later, Mr. Chairman, if you permit the nominee. And if you also look at the face of your CV and the educational background, I do not think it's possible, F and G, that you were at the University of Ghana and at the London School of Accountancy at the same time, 1975 to 1978. I want to believe that is an error.
An error.
So, Mr. Chairman, I believe the nominee will tidy these matters up so that we can have consistent records.
Can easily be corrected. 1988 to 1980, 85 to 1988, the London School of Accountancy.
And the page 2, you have the item numbered G and H, Deputy Minister, Ministry of Transport and Communication, 2001-2003. Deputy Minister, Ministry of Roads and Transport, 2001 to 2003.
Honorable Chair, I can explain that. The first reshuffle by President Kufuor took me into that situation. I was put in charge of Deputy Minister in charge of Transport. And the first reshuffle hived off Transport to join with Roads. So I was pushed with my Deputy Minister portfolio to join Roads. And that is how come I served in Roads and Transport.
Yeah, but I'm sure at different dates, isn't it? Because what you have here is 2001 to 2003, same period.
The same period. These two ministries,
yeah,
the same period. No,
so these matters, in relation to the CV you presented to us 4 years ago, kindly have a look and let's clean them up.
Thank you.
I want to start with my substantive questions. I hold in my hands the Auditor General's report for your ministry from 2017 to 2019. This is particularly important because you have quite a strong reputation in this House. You were Vice Chairman of the Public Accounts Committee from 2009 to 2013, and became Chairman of the Public Accounts Committee from 2013 to 2017. And I recall those days, all of us as ministers, anytime we had to appear before you, it was quite a dreaded day. You were a very sharp chairman of the Public Accounts Committee, very intelligent chartered accountant.
I would say.
And so if you want to interrupt, you can go ahead.
I can't remember if my colleague actually appeared before my committee during those days.
I appeared on a number of occasions with my bosses, my ministers, as you recall. And you executed your mandate to the admiration of many as chair of the Public Accounts Committee. And I recall that when His Excellency the President first nominated you, he told the nation that the reason for the nomination was because of your financial prowess, that he hopes you help streamline the finances at the Ministry of Health. Now I look at your audit reports from 2017 to 2019. I have all three reports here. If you look at the verdict of the Auditor General, for example, at page 107 of the 2018 report, the Auditor General writes, "Our review of the mechanism in place at the Ministry in respect of the accounting for withholding taxes was not satisfactory." Was not satisfactory. The Auditor General report, if you do the tabulation, which I have done, beyond the frustrations the Auditor General has documented here. If you take the 2019 report, for example, at page 86, it says, "Our review of the mechanisms put in place at the Ministry in respect of the accounting for withholding taxes was not satisfactory," unquote. Paragraph 176, page 87, says, "To minimize the risk of abuse, we urged the Ministry to exercise strong control over the accounting processes to ensure compliance with the provisions of the income tax law." The Auditor General reports that we have lost in 2017 21 million.
Honorable, is that report laid before Parliament yet?
Yes, these have been presented to the House.
To the House.
These are my copies, yes.
Of what has been?
Yes.
Very well.
2017, we lost 21,396,685 cedis at the Ministry of Health. 2018, Ghana lost 23,142,246. 2019, we lost 18,489,433.86 cedis. A total of 63,028,364.86 Ghana cedis. A colossal amount, huge amount. As former chairman of the Public Accounts Committee, how do you respond to this, particularly in relation to a recent report I've been reading, published online by the University of Michigan, Capacity of Intensive Care Units in Ghana? I'm sure you've seen that report by Moses Sion Frimpong, Sumka Ruture, Nana Sefa et al. And they say that...
And what is the question? Now you're moving from Auditor General's report to intensive care unit report.
Mr. Chairman, it's important, if I will be permitted, you'll get the nexus.
First.
You'll get the nexus, Mr. Chairman.
Can I control the proceedings, please? You asked him a question relating to the Auditor General's report. If you let him answer that, then he can follow up. But now you're lumping the two up, and the rest of us must follow you. Please.
Mr. Chairman, I'll follow your guidance. So, Auditor General's report, over 63 million cedis lost at your ministry. Former PAC chairman.
Mr. Chair, just like my colleague mentioned, I'm also very, very familiar with Auditor General's reports. And if you sit in the ministry as a minister, these type of misdemeanor challenges will only come to you after auditors have come to audit. They will then submit management reports. That is what comes to the minister's office, that this is what is happening under you. Can you do something about it? Now, even our Public Accounts Committee, the accountants are allowed space to try to rectify these anomalies. So if they find this anomaly against a ministry or an accountant, you won't have to go and rectify. We do something like implementation of auditors' recommendations. So I want to believe that by now, if Public Accounts Committee had interrogated this report, the withholding taxes that might not have been withheld, or those that might be withheld but have not been paid to the GRA, might all have been now implemented as recommendations that they should get through. So the initial recommendation will look like they have lost it. But if we're waiting for Public Accounts Committee to sit now, you realize that the ministry might have done something about it, and all these things might have been recovered or corrected. So for now, I wouldn't say we haven't taken a look at it. Any audit, management report that comes to me, we have an audit committee that interrogates this and try to rectify them. But this initial report that comes will give them space to correct anomalies. I may want to look at outstanding recommendations that have not been implemented. And that is where I will say I might have found myself faulty or I haven't done so well. So we may need to interrogate that other report to see whether they have worked on it or not. Thank you, Mr. Chair.
Mr. Chairman, by way of follow-up, these are audit reports from 2017. Can you be more specific as to what you have done? And I want to relate that to reports emerging that Ghana does not have adequate ICU beds. These 63 million cedis, you can use it to solve that problem. You can use it to buy ventilators. It can help us in our COVID fight. There are several regions in this country, if you look at this report, without a single ICU bed. Upper West region, Western region, Western North, Ahafo region, Bono region, Bono East region, OT region, Savannah region, Northeast region, Upper East region. Not a single ICU bed. And we have all these loopholes in the system. As minister, what are you doing about it specifically?
Colleague, the question becomes a little bit more complex with linking. But all I want to say is the fact that the withholding tax for Minister of Health doesn't lie in our hands. It gets into a consolidated account if we pay to GRA. So there is no guarantee that that money will come to do this for us. Even if we have collected it, it may have been allocated to Minister of Foreign Affairs or Education or somewhere else. The bottom line is that
our interest is, could you have done something more to ensure that the money went into the appropriate account? That's what we're interested in.
Honorable Chair, yes, I have explained. The specific question he asked about these particular ones, to be difficult for me to answer because there are several infractions that we deal with when it comes to audit reports. And for you to pick just one or two items to come up with, I can't offhand remember what has been done about it now. But our audit committee is composed of even people from outside the ministry who admonish the accountants who work on it, not only the minister. And I want to believe that going forward with my presence in that ministry, some of these things will see some improvement, enhancement in them. I can't hold brief for directors and accountants who are working, but when these things come up, what I do as a minister or a supervisor, I do try to correct some of them. When I joined, audit queries from Global Fund and other Gavi and all that has reduced. A lot of them have actually reduced. And I'll continue monitoring and make sure that all recommendations from auditors' reports are seriously recommended in the ministry. Honorable Chair, thank you.
Thank you, Mr. Chairman. Mr. Chairman will be counting on his expertise and experience in that regard. The second issue I want to focus on, Mr. Chairman, is the matter relating to the arrangement you put in place at the airport ahead of the reopening of the airport on the 1st of September. What I call the exorbitant $150 charge per antigen test. Can you tell us how the company known as Frontiers Healthcare Services Limited came to be given that contract to carry out the antigen test, and how you also came by the amount of $150?
Thank you, Honorable Chair. Honorable Chair, it will be very difficult for me to answer this particular question. Why? Because there's a presidential task force that is supporting the ministry to do the COVID battle. This particular arrangement was put in place by the task force that reports to the president. Now, they actually did the procurement for the, how do I call it,
Sorry, Chairman, just while Minister, whilst you're landing, is the Presidential Task Force a procurement entity under Ghana's procurement laws? We need further details, but we're happy to hear you further. Thank you, Chair.
Please, in the midst of the pandemic, I would say this wasn't an anomaly. We had groups that were doing various things. And for the task force to partner with the private sector person to do what we did, knowing very well that the ministry itself didn't have the capacity to do and install the type of equipment they put there, I think was quite normal as an emergency arrangement to have done that.
Chairman, just to take note that we would be requesting the chairman of the Presidential Task Force to be in attendance to give evidence to this committee as a witness to testify to what the minister is submitting before your committee.
Well, that's your suggestion. We can discuss later. Kindly continue, please.
By way of follow-up, are you aware that the company Frontiers Healthcare Services Limited, by registration number from the certificate of incorporation I have here, CS1140922020, was only incorporated on 21st July 2020, a few weeks to the reopening of the airport, and it had no medical laboratory experience? Are you aware?
I would say I'm not aware.
Are you also aware that
Honorable Okudzeto Ablakwa, you exceeded your limit by about 6 questions?
Not at all, not at all, Mr. Chairman, not at all.
Just ask for one follow-up.
Not at all.
One, Honorable Member, you had about 5 minutes to talk about CVs. I ignored that. Then you have asked 3 questions. Now you've done follow-up. So you've way exceeded your limit.
Chairman, just allow me to conclude on front line. Conclude on front line.
Mr. Chairman, I conclude on Frontiers. The Fees and Charges Act, you're a senior member of this House, requires that the $150 should have been brought to this House for approval. It wasn't brought to this House. The Health Institutions and Facilities Act 2011, Act 829, requires, under the first schedule, section 11.2, that clinical and biomedical laboratories must be licensed before they operate. When they started operating on the 1st of September, I have obtained the certificate from the Health Institutions, Health Facilities Regulatory Agency, known as HEFRA. They only licensed them on the 3rd of November 2020. So by the time they were operating at the airport, human lives were at stake. They had not been licensed. Minister of Health, are you aware of these clear infractions of our laws?
Honorable Chair, in the pandemic, we had a phrase we were using that we were not in normal times. There were certain things that we had to do and try to rectify as we go forward because of the urgency of what we should do immediately. This licensing was done even on my insistence when I went around to do the checks and find out that this hasn't been done. And I said, no, quickly, let us go and rectify the anomaly before things get worse. So when people are dying and people are flying and people want to visit wives and husbands and they can't go, and we needed to open the airports, and we had to put in place something immediately for them to be able to be screened to try to stop importation of the virus into our country. Honorable Chair, I must admit that some things might have done.
Couldn't Noguchi have done that?
You know, not normal instance, and that is why we have this. Honorable Chair,
thank you. Yes.
He's asking another question. Couldn't Noguchi have done that?
Honorable, I didn't admit that question. Yes. Now I'll move to the. Yes.
I no comment.
Yes, Patrick Bama raised his hand. Yes.
Thank you very much, Chairman. Congratulations, Honorable Minister-Designate. Honorable Minister, I have in my hands the Public Health Act, and Part 2 deals with vaccination. Recently, the President announced to the country the strategies he has in place to help Ghanaians get vaccinated with this COVID-19 pandemic that we are facing as a country. And Part 2 of the Public Health Act mandates, Honorable Minister, mandates you to appoint other registered medical or veterinary officers and other persons certified by a senior medical officer with the necessary competence, skill, and knowledge to be able to assist a public vaccinator. You have public vaccinations, compulsory vaccinations, vaccination of adults, and what have you. What strategies have you put in place should we procure these vaccines to get Ghanaians prepared and other certified vaccinators in place to be able to go around and administer the vaccines professionally as stipulated under the Public Health Act? Thank you.
Thank you, Honorable Chair. Honorable Chair, I must mention that one thing Ghanaians should be proud of is the fact that we have a very robust expanded immunization program that sits within the Ghana Health Service. It has a structure that reaches everywhere in this country, within the Ghana Health Service. It has a structure that reaches everywhere in this country. As I speak, our traditional vaccinations in terms of polios, DPTs, and all that, by WHO assessment, we are doing 95% coverage in our country. So when we started developing the vaccine strategy for COVID vaccinations, we thought it wisely not to reinvent any wheel, but continue to rely on what is good for us. So if you look at the strategy when it's fully completed and confirmed, you will see that we're using Ghana Health Service infrastructure to actually do the vaccinations when COVID comes. We've started training those who are doing vaccinations, especially for even COVID, so that immediately we get a, how do I call it, the stocks. We can move in quickly to do our vaccination.
Chair, as a follow-up to that question, I understand that some of these vaccines ought to be stored under certain conditions. Do we have those storage facilities in place, or measures are being put in place to get them? Thank you.
I'm afraid we don't have such ultra-negative cold chain equipment, but we have cold chain equipment that can take some types of the vaccines that we are looking for. The indications we are getting, the first vaccines that we may get with AstraZeneca, that can be stored in our current or existing cold chain infrastructure to do the work I want to do. One other one that is coming up, Johnson & Johnson, if you're able to even get stocks from that end, that can be stored under normal room temperature, so we might not have so much challenges. We do have limited capacity for those ultra negative cold chain facilities, some limited facility. If you should get some quantities, we can store them in Accra and Kumasi, for example, and use. We don't carry them across the country where we don't have any place of such nature. Thank you.
Chairman, my second question is on our party's manifesto, page 157. The New Patriotic Party, the ruling party, 156 to 157, lists about 13 focal points that government wants to achieve under the second term of the president. And And it includes, but not limited to, focusing on telemedicine to enhance health delivery. Can you address us on how you intend to pursue this vision of the president and the party and government? Thank you.
Thank you very much. Honorable Chair, we started working on telemedicine. We have a small committee in Ghana Health Service that is engaging to look at infrastructure and training and what have you to actually get infrastructure to do telemedicine. So there is a program in place to enable us to achieve this manifesto pledge, and I believe going forward we'll enhance our activities in there and speed it up and make sure that we're able to position ourselves to do.
Thank you. Last question is on the same Public Health Act on advertisement, and I'll tie it in with traditional medicine. We've seen that the FDA has taken steps and has been clamping down on manufacturers of non-certified or licensed products. Some included QRFS and others. What are some of the challenges that you think these traditional health manufacturers of these products are facing, and that you, when approved, could be of help to assist them in this regard? Because I believe it's a big industry that the ministry ought to look at critically. Thank you.
Honorable Chair, if you look at the manifesto, one of the things is try to promote traditional medicine. They have an association, a very large one they call GAFTRAM, and we meet with them quite frequently to try to encourage them to register their products with FDA. To register, there are two things that they need to find out from whatever concoction, whatever medicine you present to them. First of all, the Center for Plant Medicine Research will have to test for toxicity, such that you don't put in organisms or toxins that can cause other diseases to people who take your medicine. Then after that, FDA will certify for safety. And if you go through these two processes, then they give you a license to market your product with a shelf life that will give expiry and all that. So when they register you for this, FDA has got a surveillance unit that goes around the markets to try to check registered products and non-registered products. If they find non-registered products, they will want to take them off shelf and probably even prosecute the corporate who is doing that. If they find that you are selling expired medication, not only traditional medicines, but even the ones imported from elsewhere, right, they will clamp down on you. And that is the way for FDA, and I believe that is happening. And therefore, we wouldn't discriminate against traditional medicine people and the orthodox medicine people. So far as we are doing expired, we are doing products that are not registered, they will clamp you on. We are encouraging them, we are educating them, we are facilitating them to get their friends to FDA and plant medicine research for these particular tests to be done and approved, certified.
Yes, yes, Honorable Member for Tamalinov.
Well, thank you very much, Mr. Chair. I wish to exercise my opportunity of a follow-up of two by starting with the use of one of those, Mr. Chairman, if you will oblige.
The use of what?
The use of one of the two follow-ups that I may have to.
Honorable Member, your follow-up should be after an answer to a question. So go ahead. If an answer requires that you follow up, I will not object to it. Please go ahead.
Mr. Chairman, I thought it relates to an answer given and not an answer given to necessarily my question.
Well, as long as you stay within the agreed rules,
all right,
you're clean.
Thank you. So it relates to a question that the Honorable Samuel Okudzeto Ablakwa asked, which has to do with the charges at the airport. Mr. Chairman, is a nominee telling this honorable committee and the people of Ghana that as minister responsible for the ministry, because he's a former minister of health at the time, because we were in abnormal times, he acted negligently and overlooked infractions of the law and even assisted a company that was fraudulently operating at international airport, because the minister
Honorable Member for Tamale North, can you ask your questions, move out the imputations of crime, and you know those are not admissible questions.
Good afternoon. Welcome to Joy News today with me, Daniel Dazi. In our headlines, Parliament vets Ministers-Designate with strict adherence to COVID-19 protocols. Immunologist at the West Africa Center for Cell Biology and Infectious Pathogens warns Ghana should be worried about the rapid spread of coronavirus in our communities. We also have business and sports in this bulletin. Welcome. We begin with Parliament's Appointments Committee, which is vetting President Akufo-Addo's ministerial nominees today with strict adherence to COVID-19 protocols, which were introduced to curb the spread of the virus. Health Minister-Designate Kwaku Agyemang-Manu is before the committee explaining why he should be approved by Parliament. Let's take you back to the House to listen as members of the Appointments Committee vet Mr. Agyemang-Manu.
That's the question, Mr. Chairman. Thank you, with all due respect.
Yes, Honorable Minister, were you negligent in your duties?
Mr. Chairman, my simple answer is no.
Mr. Chairman, the honorable nominee was on radio and said, out of, I believe, frustration or exasperation, that he was tired and that the president is tired and that all those who have been working on the COVID team are tired. Mr. Speaker, based on his admission of being fatigued, how can he convince this committee and the people of Ghana, given the fact that COVID doesn't seem to be showing any signs of going away anytime soon, that he still has the energy to continue as Minister of Energy, given the admission that he's tired? I mean, the Minister of Health, sorry.
Well, I would say, I'll answer the last bit of his question first. That can I continue during the week? But I would say I have the privilege of having my wife here. So probably she can assist me answer that question. Adwa, am I tired?
You're out of order.
Mr. Speaker, sorry, Mr. Chairman, the translation of what I said here is wrong. 100% wrong. I made this admonition at a function in my constituency, Domahinko, and I spoke in Bruno. So whoever translated it to English got it entirely wrong, and that is not what I meant. Thank you, Mr. Chair.
Is there anything you want to tell us relating to that
Chair,
matter?
Nana may can say. Money, Yadia Hodin Yeleguso. Nippon Sunya no Montie, Diario Encoda. Does that mean we are tied?
Okay, so translation. Kindly translate that to English.
The emotions, Mr.
No,
so you can translate for me. Mr. Chair,
Napo, Chairman has directed.
It's unfortunate that this has come up here, but that was not what I meant. I was trying to tell people that they should have sympathy on those of us who are fighting the battle and listen to the admonitions we were putting into a public domain to adhere and comply with the protocols. That was all. Then a journalist who may not have gone up to a level that he should have reported properly, put this in there. I got the opportunity. Yes, I confronted the man who did that. That why do you misquote me in the language that, I mean, my people wouldn't easily understand? I was talking to the man people. And I got opportunity, I didn't say it on radio, maybe let us correct that too. To tell them, when they published this one, I went there to try to deny the matter, that this is not my intention, this is not what I said. And it's unfortunate that my colleague is bringing this matter up here. So I think I've corrected the fact a little bit. I'm not tired. I said you can ask my wife. Obish is your friend.
All right, Mr. Chairman, public officials have a duty to be candid and also to be honest. This is a follow-up. Mr. Chairman, the nominee is before us and has in Bono told this honorable committee what he said. Mr. Chairman, I have what the honorable nominee said on tape. I have it on pen drive, and what the honorable nominee claimed he said, as repeated on this set, is not true. And Mr. Chairman, with your permission, I would like us to play back and compare what is on tape to what he claimed he said at the place. Because, Mr. Chairman, this is important because the honorable nominee is on record again to have said there was no generator at the University of Ghana Medical Center. It turned out not to be true. The honorable nominee is on record to have said he didn't have COVID at the time he had COVID. It turned out not to be true.
Honorable member.
Mr. Chairman.
You know, there are rules about anything you want to do in here. If you want to do a follow-up question, please do so. But for now, leave the commentary. Just go out with your question. You said you want something played. There's a rule for tendering what evidence you have. If you follow that, you'll go through it. But for now, you may please proceed with your question.
So, thank you for your guidance, Mr. Chairman. So, I wish to tender in the voice recording of the nominee for this committee to consider and compare with what he has told us that he said on that day. Mr. Chairman, with your permission, I tender in the voice clip.
You table it.
Well, I tender it in.
No,
I table it. Thank you.
Please take hold of it. Yes, please proceed.
All right. Mr. Chairman, This is now to my second question. In the absence of handing over notes, I went to look at the report of the Appointments Committee of the 7th Parliament when the nominee appeared before a similar committee.
Alhassan Suhuyini, the Member of Parliament for Tamale North, asking the Minister-Designate for Health a key question relating to the last time he appeared before the Appointments Committee of Parliament. A few minutes ago, there was a bit of drama because he wanted to tender in a voice recording of the Honourable Minister-Designate when he was speaking back at Doma Ahinkro. Let's get on the phone line and speak to Kwesi Parker Wilson. He's standing by for us at the Appointments Committee sitting to see exactly what panned out. Parker, what did we just witness? What are the options available to Mr. Suhuyini, who wants to tender in a voice recording as evidence? Right, Parker, can you hear me? Kwesi Parker Wilson is our man standing by at the Appointments Committee of Parliament. We know that today the committee will be seeing the Health Minister-Designate Kwaku Agyemang-Manu, after which the National Security Minister-Designate Albert Kandapa will also be standing by. We have Parker Wilson on the line. Let's go to him now. Hi, Parker, can you hear me?
I can hear you, Daniel.
Great. So what did we just see with Alhassan Suhuyini trying to play a voice recording of Kwaku Agyemang-Manu? What was that about?
Oh, it was about comments the Health Minister-Designate had made over the months gone by with regards to the fight against COVID-19, where he allegedly made a comment that he's tired, the president is tired, and all government officials are tired. That his interpretation or explaining to the committee was that the Member of Parliament, that is Suhuyini, did not understand the context upon which he made that comment, and that he wasn't directly making the reference that he is tired, actually tired of the job, and that he wants to leave. So that was a misunderstanding. And but the Member of Parliament insisted that that was what he really meant, and so he decided to tender in that evidence for the committee to play and listen for themselves and then make their own judgment based on the comments the Minister-Designate made some months gone by. So the Speaker has, the Chairman of the committee has admitted that, and then they'll go through it appropriately, and then they'll pass their judgment on it.
So what does that mean? That they will play the tape at a later date?
Okay, so in times past, that has been the situation. When there's an evidence, the sitting caucus, and then they play that, looking at the situation at the moment and the fact that we are observing the COVID-19 protocol, and the chairman himself has indicated to us that they want to make sure they vet all the ministers quickly so that they go to their various ministries and then work. We don't know how those will pan out.
Right. Kwesi Parker Wilson, thank you very much. Let's go back to the House. To listening to the ongoing vetting.
Eurojet projects that has 7 hospitals. We have commissioned about 4 of them, and there's work ongoing in about 2 or 3 that has not been done. We've done and completed WA. We've commissioned Fifupraso. We've commissioned Nsoko. Now they are working seriously in Sewua and Konongo. We have commissioned Tepa. The chip compounds or health centers that President Mills started, 10 of them in Central Region. I supervised and signed more than 30 certificates on each to complete the projects. And remember, it was published when I went
did you do the stock taking?
Yes, why not? I did a stock taking. I don't think I have
you can move to the next one.
So I did a stock taking. I've completed virtually all of them. The ones that have not been completed, there is work ongoing on them. And I can mention specifically some of them that I can remember. Okay? Including even Bekwai. That was left there for years. Right? Yes.
No, please. When we say be quiet, let's not bring comparisons.
Honorable colleague from Bodi, yours will soon come. Please, let me finish my question. We will give you a hospital. Don't worry. This one, I will assure you. So you can also write it down. No, it's only my colleague.
Yes, please proceed.
Bodi is a very deprived area. We will see to Bodi. Now, the mental health. We have revised the policy. We've got the law in place. We have done the LI. And through that, we've managed to get some funding from DFID. That is giving them close to about £400,000 every year to begin to do mental health issues in the country. I've worked on that. Now, exclusive list of the elderly to take care of them. Honorable Chairman, honorable colleague from Bodi, I shouldn't even have mentioned this. This is between the two of us. So I've withdrawn. Let us put on record. So, Honorable Chair, with your indulgence, let this be on record that the assurance to Honorable colleague from Bodi has been withdrawn.
Please, let's proceed.
So let me continue, Honorable Chair. We have started engaging in gerontology seriously in the ministry. We've just launched our HR policy, revised one, that is going to take specific care of the elderly. We are trying to fast track the training of some of our young people who are learning to become nurses, those especially with certificate grades, to do post-basic diplomas in palliative care and geriatric care. That is an area that will take care of the elderly very much. We have started piloting on my own resources.
Just to save time, Mr. Chairman.
So it's okay, then I can move.
You haven't done the list now. That's
in the chamber after we this. Mr. Chair, I think I've done with this question.
Yes, you have your last one.
you're not done, but we'll move on. The Public Procurement Authority Board on 13th March 2019 at its CIF meeting overturned, or if you like, annulled a contract that your ministry awarded to Farmanova Export Private Limited. In the board's minutes, the reasons given were: one, the decision by the respondent, in this case your ministry, to award the contract to Farmanova Export Private Limited of India is hereby overturned and the award given is duly annulled. Two, the respondent is hereby directed to disqualify the two companies, Farmanova Export Private Limited of India and Farmanova Limited of Ghana, on the basis of the tender documents and to conduct a re-evaluation of the remaining tenders received using a completely new panel of evaluators. Three, pricing submitted by other tenderers and to desist from entertaining excessive prices as guided by 28 of the Public 8A 2D of the Public Procurement Act 203 Act 663 as amended. Now, Mr. Chairman, I'd like to know from the nominee that what resulted in the PPA board having to step in to cancel this award, and if the nominee is minded to also speak to an assertion that he subsequently, through the ministry, awarded a sole sourcing contract to one of these companies that were denied, that was disallowed from carrying out the contract. Thank you.
Yes, Honorable Minister.
Thank you, Mr. Chair. Mr. Chair, this was brought to my attention from the PPA. And I think the report is read. Let's say about 90% was contained in that message I got from PPA. I quickly invited the Procurement Authority Chief Executive and requested that they should come to do a procurement
sorry,
audit.
for the record, who was the Chief Executive at the time? Just a name for our record.
Mr. Agyemang-Manu. I called him on phone that when I got the pen, I went to take the documents, the tender and evaluation, entity tender documents, and looked at it. And I asked him to send people to come and do a procurement audit to guide me solve the problem that has been created. Now, it took the PPA close to about 3 weeks before they brought the auditors to come to do the audit. When we got the report, I did exactly what recommendations they gave me, that we should do re-evaluation. I expanded the re-evaluation committee and brought in more pharmacists from across the country to come and sit with my procurement people to do the evaluation. It took us a little bit of time. When they finished the evaluation, I sought audience from FDA because the vaccines they were bringing, anti-snake venom, is a very delicate issue. Then FDA also came to give me some advice on what steps we should take. Mr. Chair, before I was aware, the PPA had given Ghana Health Service sole sourcing authority to bring in the product we were seeking to procure to serve the system because we were running out of these anti-snake venoms. Ghana Health Service didn't have any budget for it. It wasn't in their procurement plan, but PPA allowed the sale, the procurement to go on within the Ghana Health Service enclave. FDA registered the products and tested and released them into the system. Then they came to payment. The budget that we have set aside to do the payment if we had procured through the window that we were procuring had to be used to pay for what Ghana Health Service had procured. So we ran out of budget to procure anti-snake venoms by the ministry. I contented myself with what has come in the system, said that we could run. Mr. Chair, when I went into the ministry, anti-snake venom was done on sole sourcing basis. 2017, they have virtually selected and completed. I only signed to bring in anti-snake venom because they were running out of stocks. I commissioned that we should go public tender and get the procurement done through the entity tender committee instead of sole sourcing. And then this problem was created virtually for me. We wrote back to Procurement Authority that we don't have any budget again to continue this particular procurement, so let us hold it. Then I asked my chief director for advice. And then he said to me that instead of going up and down and getting these challenges, why don't we add this one to the list of medicines we're going to do with framework contracting, so that when we select a supplier from that window, then the hospitals can procure from that supplier as part of the framework arrangement. Even that, central tender venom, somebody had petitioned. When you move here, there's a petition here. When you move there, meanwhile, we're running out of stocks. So I had to go to make a presentation to a central tender review board before they allowed us even to include it on the contract, framework contracting window to enable us procure vaccines to do the work. So, Mr. Chair, I believe I took good steps to get these vaccines into the system to avoid people dying unnecessarily. And I don't think I have had any serious infractions on this matter. It is not pending anywhere. There hasn't been any report. Central Tender Review Committee has given eventual approval, and we have gone ahead to do the procurement to enable that we stock the system with necessary vaccines to stop snake bite deaths. Thank you,
Chairman, I have a small follow-up to Honorable Sohini. Was there objection by the Central Tender Board in addition to the Public Procurement Authority on the procurement of this particular anti-snake venom that officially you were written to?
The objection was on our inclusion of the snake venom in the framework contracting list.
Did you have a problem with Ghana Health Service undertaking that procurement activity as an independent institution under your watch as minister?
Yes, I did. I raised issues with procurement authority as to why Ghana Health Service did not have it in the procurement plan, but they approved sole sourcing for Ghana Health Service to procure the medicines. But because we were running out of stocks, I allowed it to go. And my admonitions to the Director General was, why didn't you consult with the minister before you took that step?
Does something ring in your mind, some approval from the FDA of what medically is known as VINS, VINS? Does it ring a bell in your hand?
Yes.
Of this approval and accreditation?
Honorable Chair, when I went to the ministry, the product I signed for them to procure was the VINS product.
Are you aware that His Excellency President Nana Addo was petitioned on this matter?
The petition went to several places, even including Parliament, if I can remember.
I'm more interested in the one which went to the President. I will be happy what actions.
On my copy, on my letter, I saw a copy to the Office of the President.
To the President. Chairman, probably when I get my opportunity, this may be some of the issues for which we'll demand further clarity on. I thank you, Chairman.
Yes, Honorable Reverend Asen South, yes.
Honorable Chair, I am grateful and congratulations to you, Honorable Minister-Designate, on your nomination. Your tenure as Minister for Health within the period 2017 and January 2021 was characterized by a relative quiet on the labor front, which recorded very minimal labor agitations. That obviously is a notable achievement to your outfit and that of your team. However, given the current circumstance that we find ourselves in the midst of global health crisis, going forward, what policy and strategy do you intend to prefer in terms of compensation, incentives, and in terms of stakeholder engagement to be able to achieve a continuous courting of cooperation and support from our health workers and in particular our frontline workers? Thank you.
Thank you, Mr. Chair. Mr. Chair, I went into that ministry taking cognizance of my background, not being a medical person, with a lot of humility, a deep sense of humility, to respect people in that ministry. That is the only trick that has worked for me. I got tremendous support from the Minister for Labor and Employment, as well as the President and the Finance Ministry. We did negotiations. At times they were tense, but we managed to solve our problems indoors, never coming out. And some strategies I can't pour out here, but one thing I want to remind the committee, Honorable Chair, the fact that I was trained in management accounting, a workroom manager who should be able to work in every sector of any economy. And that is the knowledge base that I have that has helped me do what I've done that we are commenting upon. Going forward, I will continue to use that same strategy and enhanced things. I do a lot of stakeholder engagement. I meet with them quite often. We chat together, and I get their problems to be resolved. Assurances that you're asking me to give will be very difficult for me, Honorable Chair, because all that you do will have to be done with the approval of Minister of Finance, and they will have to consider their, how do I call, indicators and their budget caps and things like that. So it will be difficult for me. But I believe I'll continue to fight for what will be good to satisfy my the health workers that I work with, such that we continue to have a very congenial labor atmosphere within the sector. Thank you.
Mr. Chair, there is an age-old challenge confronting the health sector of the country, specifically to do with doctor-patient ratio. Over the years, we haven't been successful at attaining the World Health Organization WHO recommendation of 1 doctor, 1:1,320. At the moment, we are at an alarming ratio of 1 to 10,450. What policy framework, as Minister for Health, should you be approved by this committee and subsequently by plenary, would you implement in the medium term and in the long term to be able to achieve optimum levels of doctor-patient ratio in Ghana?
Thank you, Honorable Chair. The only strategy is accelerated training and facilitation of young doctors, medical officers to go for training. In the meantime, over the last 4 years or so, we have introduced free postgraduate training for all medical officers in our country. So those who get admission to go to the college, the government pays for their fees. And that is enhancing them to come to specialize before they qualify to go to the fields to work. Again, when I talk about selected training, schools are getting expansions to intake more students to do medicine. There's a policy that allows accreditation for private sector facilities to also train doctors using public clinics in partnership to train them. Again, government hasn't stopped sending young graduates outside to also train to come back as doctors to help our system. So these are strategies that we are using to try to see if we can, within a very short, medium term, cut down this type of racial inequity, imbalance to help our system. Thank you, Mr. Chair.
No, Honorable Member for Medina, is that right?
Thank you very much, Mr. Chair. I want to use the opportunity to congratulate the nominee for his re-nomination for the position. And talking about the labor front and then manpower, my colleague just made reference to doctor-patient ratio. I am aware that as we speak now, we still have about some 580 qualified medical doctors, new medical doctors, who are yet to be posted or absorbed into the system. What would you do in the shortest possible time if you have the nod to ensure that these doctors are absorbed into the system?
Thank you very much. I'm a bit surprised at the numbers my colleague is giving me now, and I'll quickly check on this if it is correct. Because for the last 2 years, we have changed our system to avoid young doctors staying home for any period of time before they get posted. Fortunately, we are getting financial clearance from Minister of Finance to the extent that even if it's a single doctor who has qualified and hasn't got a place, we'll write to them and they'll quickly give us financial clearance to actually employ them. So I'll quickly check on this, whether we have got their financial clearance, whether their financial clearance is still in finance, and what is actually holding on their postings, and for how long they have stayed at home. When I do that, probably these things will be resolved as quickly as possible.
Mr. Chairman, the second question again is on labor-related matters. One of the institutions that has widely abused the use of contract workers and has been the Ghana Health Service. There are several numbers of workers across the country who are taken as contract workers, and contrary to Section 75 of the Labour Act, have these contracts renewed over the years, and some have served as much as 17 years, 16 years, and yet they still are casuals within that space. What would you do to mechanize these casual workers when given the nod?
Thank you, Honorable Chair. Honorable Chair, as early as 2017, when I was sworn in as the Minister for Health, I started that area and I wrote to all health facilities not to recruit contract workers, for us to engage to find out what. Like I said earlier, I went to the sense of humility and positioned myself to learn. So I was learning from the system at the time, even before I wrote that letter, because I realized that it was infringing on some aspects of our labor laws. The one I stayed on and they were tutoring me and I was learning very fast and I got the experience in it, I seemed to have agreed somewhat with what they had. They were not getting financial clearance in the past, prior to 2017, and they needed people to work, especially orderlies, people who are cleaning the hospitals, people who are washing, working the laundries, including even nurses and midwives. So we have to accelerate recruitment and see how best we can mechanize these people. They have been allowed by the guidelines of our internal generated funds in the facilities to pay such staff with what they generate internally. And I was a bit amazed. The IGF, they have approval from finance to utilize to do recruitment at the facility level. But that was also helping the system. So I couldn't sit there as a minister who understands and knows the laws and stop all these to break down a system. So I started engaging. And that is part of why we have been able to recruit close to about 90,000 people, in addition to those that we have mechanized. Over 90,000 people, yes, in the last 4 years. And we are still engaging with finance. We write, we do budgets, we put in the non-mechanized staff to try to mechanize them. I've had engagement with Ghana Health Service. Our strategy, initially, I was suggesting that why don't they even surrender the IGF and let us put it in the consolidated account so that we can mechanize them and get paid from there. We are still working on some of these mechanisms. We haven't come to a conclusion yet. But I believe over the next 3 or 4 years, if I get a note, some of these problems will be tackled a little bit more vigorously.
I follow up. Very well.
Honorable Minister, I want us to be clear. Are we talking about casual workers or contract staff?
They are casual workers.
Casual. The question started from contract workers. That's what I want us to be sure.
No, these are technologies that are used interchangeably within the facilities. I want to believe that not 90,000 casuals, please. I said people, nurses and midwives and new administrators and new accountants and some mechanized, non-mechanized have been put there. That is
very well. Yes, you may continue.
Thank you, Mr. Chairman. Just a quick follow-up. Honorable Minister, would you be able to give this committee and the people of Ghana and all these people out there some time frame within which we can work this thing out? Because some of them have been basically exploited for several years.
I would say I have taken cognizance of this problem. But for me to sit here to give time frames, I don't control the issuance of financial clearance. So my ability to resolve the problem will depend on what time frames Minister of Finance will give us the room to be able to do the mechanization. So we are still working on that. It's work in progress. And for me to give time frames will be a little bit difficult for me.
Very well. Mr. Chairman, my third question is on mental health. When you look at Section 88 of the Mental Health Act, it provides that mental health care is free. Now, this act was passed as far back as 2012, but we know there are serious challenges with funding, with mental health in the country. Would you consider a potential amendment of the Act to place mental health care under the National Health Insurance Scheme? Because as we speak now, when you come to Pantine Hospital, a lot of people with mental health cases come, and some don't even have money to pay for folder and very basic services that under the Act are required to be free, but unfortunately are burdened with payment for these services.
I think I'll answer very simply, yes. It is under consideration. We are talking about it, but simply I will say yes, I will consider. If the amendment of the law is what will solve the problem, I will so do. Instead of administrative instructions, I continuously give. So I'll consider that.
And just a quick follow-up, because I mentioned the Pantine Hospital, I don't know whether it has come to your notice that the mental health facility at Pantine has been heavily encroached. The space, the government lands around the hospital have been heavily encroached. If it has come to your attention, what is the ministry going to do about that? Because my understanding is that the staff and health have actually submitted several petitions to your office as a minister.
Good. Honorable colleague, I'm very much aware of the encroachment in Pantine. We started even doing some fence walls in some very critical areas when we started rehabilitating the Ghana Health Service Training Facility and turning it into a treatment center, which is now being completed. We have already contract for some fencing to be done, but not the entire stretch. At one stage, I asked one of my deputy ministers to go and contact the chief executive of the La Quantanai, this assembly, to stop issuing permits to those who are building in that area. My investigations indicated that the frontage of the facility was like somebody's land. Then I said it can never be true. Kwame Nkrumah will not establish this place, the former president, and leave the road in front of the hospital as somebody's land. So let us go to Roads Ministry and find out the original site plan of Pantine Hospital to see if this part is not a road. Then the courts will grant, how do I call it, judgment to people and give them title to the land. So what we plan doing now is to try to do compulsory purchase. And we're engaging with finance to give us money. We send land valuation to do some cost estimation for us to try to see if we can find resources to do compulsory purchase and even pull down. The irony was that one of the buildings is so close to a mortuary in Pantine. Meanwhile, the person has built there. And every time you go there, they bring their people. At one stage, we were thinking that we send in the police and the military. And I said to them, don't let us do that. We don't have the law backing us to do that sort of thing. So let us respect the judgments that we have. So that has become a serious albatross on me, and I plan setting up a small committee in the ministry to look at not only Pantine, Tema, Cape Coast Teaching Hospital, the mental hospital even in Cape Coast. Their lands have been encroached, and we have to find something to protect these lands. I believe that will not be just the problem of only the health minister, but all of us, members of parliament, and the Ghanaian citizenry alike, to protect what lands we have. The irony, again, is the fact that now, there are some facilities even where you want to expand. There is no land for us to expand. We are looking for land to build a facility in Suame. We can't easily get. The facility at Kansawo, no doubt, never saw completion because of land. Medina, the East Hospital should have been in Medina. We couldn't get land. So the lands that we have, abandoned our facilities, should be seriously protected. And I think it's on my agenda to try to see what little efforts I can put in. But I will need your support, colleagues, and other well-meaning Ghanaians in the country to help us fight this encroachment battle. Thank you, Honorable Chair.
I sympathize with you. Largely, the problem is with the management of the facilities. People are taking it, they see it, they will not protect it. Sometimes they even colonize with them. Then you are sitting at the ministry, they'll bring the problem to you. Yes, Honorable Member for Abetifi. Yeah, Abetifi, yes.
Thank you, Honorable Chair, for the opportunity. And congratulations to Honorable Agyemang-Manu. Honorable Minister, on COVID, the numbers that are coming out, I'm sure as a management accountant, a chartered accountant, you see them every day. Do you have true faith and believe in the numbers that are coming out as COVID numbers for Ghana? Currently, 73,482 dead. Do you have true faith and believe in the numbers that are coming out? I do, but I want you to assure Ghanaians that the numbers that are coming out are accurate.
But I would say, if I don't, who else will? This is coming from our outfit, an agency that is dedicated to do this work. Then I sit on top of them as a minister and come and sit, I don't believe in the numbers. Please, I do, and I do, and I do.
Thank you. The global mortality rate is about 2%. 106 million infected, 2.3 million dead. In Ghana, 73,482 dead, fortunately. The global average is about, unfortunately, I cannot say fortunately to, for.
Temptation, sorry, Chairman, with the indulgence. The temptation for him to have said, fortunately, is the fact that he's comparing with global numbers. That is why. But I know that he hasn't got sympathy for the dead. And honestly, if you watch CNN and BBC, you will be tempted to use the word fortunately.
Right, thank you. 2% is what the global numbers stand at. Ghana is 0.66%. We are not asking for more. What are you going to do when given the nod to further bring these numbers down, even though we are doing much better than the global average? What are you going to do to bring these numbers further down to save lives of our citizens?
Thank you very much. Honorable Chair, we have battled COVID for the past 10 or nearly 11 months. The strategies we have used, I would say, has worked somewhat for us in Ghana. If you look at our deaths, if you even look at infection rates, at a point where we slowed down transmission to this level, we must be thankful and grateful to God and our president for leading the battle. If you look at the globe, the same protocols and the same things that we are doing here are about the same things everybody is doing. Fortunately for us, we even seem to have no more than some even in America. Because when COVID started, what we started doing in Ghana, contact tracing to break the spread, some big people in America didn't even understand that. So we had moved. We are not going to change so much.
Chairman, so did you say these people or some people in America?
I said some people.
Okay, thank you.
Thank you. The Honorable Vice Chair has confused me a little bit with this intervention, right? The only new things that we are going to do are the new things that are coming up on the globe. The vaccinations. Apart from that, we are now beefing up our risk communication again. We've started even to try to make sure that Ghanaians are there to the protocols. That is the only solution. But Ghanaians, we are in the habit of blaming leadership, maybe the minister and the president, for not doing enough. We forget the fact that I ask you not to drink this one, and you are drinking. You come and tell me that you caused me to drink or what. So enforcement of the rules can be there, but voluntary compliance is what is lacking that has taken us to this level. The latest upsurge that we got, you realize when you begin to do contact tracing, A family went indoors somewhere to celebrate 50 years anniversary. The mom is dead. The father is on sick bed. The daughter, a elderly grown person, is severely ill. So it's like all those in that family, just because of how do I call it, a birthday party indoors. We keep on telling people that wear face masks. You don't stay indoors continuously for 2 hours, because even the face masks don't become very effective. You see, all these things we are ignoring. People stopped wearing masks in taxis and trotros even when we ease up. And what we know is that when you are open air in the sun, transmissibility is not too huge, like sitting indoors and eating and drinking. So these are the challenges that we have, and I believe now our communication should be encouraging people to adhere to the protocols as strictly as we can, and then keep distances and see how we can avoid it. The country, the government is trying to bring in vaccines for us to vaccinate, but even that, after vaccination, first dose, you need about 28 days to do the second dose. Even after that, the nature of this disease is still not very known even to great scientists on the globe. We will still have to keep on wearing our masks.
Chairman, Brian, I hope I have your excuse. The minister just said government is trying to bring in vaccines. When is the first vaccine in Ghana? We live on hope. And when can Ghanaians expect that they will have a shot of the vaccine? Thank you, Minister.
Honorable Chair, this is Parliament and House of Records, and I will be very circumspect. The indication that we have, those of us working in trying to bring in the vaccines, is between mid-February and early March. As for specific date that we are getting any vaccine, we still do not have any indication. The stocks on the globe.
Chairman, but there are dates in the first week of March. We need firm assurance for the Ghanaian people. Vaccine, when do we expect it in Ghana? Mid-February. Give us a limited date.
Honorable Leader, I think we should leave it as this. It's a very short period. It's there between mid-February and early March. Yes, but it's not mid. So we should allow that space. He has already said that.
Okay, thank you.
Despite the president's efforts, talking to top people in Gavi, UNICEF, government bilateral levels, diplomatic high levels, there is not a single indication of a date. All they are saying is this period. So we are waiting for the period to come. All the necessary registration and orders and all that, we have done our quantification, we have developed our strategy to complete finally. But even because of the date, as to the exact particular day that we will start our mobilization, all we are doing is preparedness. Say that if you come tomorrow morning, we can get there.
So is there a procurement plan, and are you part of the procurement process?
I'm leading the procurement of the vaccine.
Thank you. Honorable nominee, you advise that the way to bring the numbers down is to adhere to the protocols. Meanwhile, in Ghana, the UN 2020 reports that 6 million of us are poor. Adhering to the protocols requires wearing of masks, use of sanitizers. It costs money. Are you going to, when you get the nod, provide the poor with sanitizers, nose masks? They just can't afford it. Thank you.
I would say yes or no. When we identify the very core poor who cannot afford, we will try and give them these masks. Honorable Champon, be very honest to the committee. You, during the campaign, where we were going around, we're not distributing masks to the poor. All of us, everybody tries to stretch our hand to go. The government, No, this was not a question. It's just a commentary. It's just a commentary.
It's all right.
Things that we are doing already as MPs. They come to your house. You give them masks.
Honorable,
the government is pumping.
Honorable nominee, thank you very much. I recall saying this when we made a statement on the floor of the House, that we should congratulate ourselves for the support we have given the country in these matters. So we should continue. Yes, are you done?
Yeah, no, Mr. Nominee, final question. How many, we started your vetting at 10:30. I think it's almost 1, and we are still here. COVID times, how many hours will you advise that we stay here?
Honorable Chair, I was going to crave your indulgence to tell you what the scientists are saying across the globe. Now, we shouldn't stay indoors. We should try to avoid maximum 2 hours. That is it. You know, but because I was threatened a little bit with a fear factor, I couldn't admonish. So that is the rule. And if you take my advice, Honorable Chair, I think you have interrogated quite a lot, and we can close.
You remind me of saying the same thing 4 years ago, when after 2 hours you said, "Aren't we tired?" We are not tired. Members of your leaders say you want to hear the lady's voice before they come back to you. Terrible. So, Honorable Mrs. Ejari.
Thank you very much, Mr. Speaker. Congratulations for your re-nomination to the Ministry of Health. Still accounting for your stewardship at the Ministry of Health, I refer you to page 34, paragraph G of the MPP manifesto of 2016, where it was stated that all existing hospitals will be revamped and then new ones will be constructed where there are none. In Techiman North, where I come from, there is no district hospital. And from 2017 to 2021 January, when you were Minister for Health, there was no sign of you in respect of a district hospital. And I also want to know what happened to the rest of the about 260 districts. Thank you very much.
Honorable Chair, I was trying to refer to Bono East. Tubodom has been captured here. Luckily, I've got it easily as part of the 101 district facilities that is coming. So Tubodom will get a hospital. Your own, I will not withdraw that one because I have seen it here. Okay. Now, let me admonish. My passion for health is quite high. Left to me, every little corner of this country should have access. Why? Because I'm part of those who are championing universal health coverage. Our president, together with 2 other presidents, actually calls the action plan to achieve that to be done. We have finished our roadmap, and I'm very thick in affairs with my directors who are working on this. But you see, when you are sitting in a system like ours, without so much resources, and the finance minister will have to distribute resources to education and to roads and to everywhere. What is given to health cannot do the type of things we said we will do all of a sudden at a go. So it's a gradual process. Over the last 4 years, I believe you will appreciate the type of investments that went into health. Apart from COVID, even health infrastructure, how we managed to complete the projects that were started by our predecessors, the type of new things that we plan doing. And I believe going forward gradually, this type of pledge will be fully met. Thank you.
Okay. Mr. Speaker, as a follow-up to this one, how sure are we that these same reasons will not be given for your inability to do the same in these 4 years when you are given the nod?
This assurance will be very difficult for me to come up with. If you are lucky to drill more wells and prices of oil goes up that high and the allocation to health investments becomes big, maybe yes, but for now, it will be very, very difficult for me to tread into the unknown. Thank you, Mr. Chair.
Thank you very much. My next question is on the La Osu Teshi Nungwa Hospital. My information is that it's been pulled down, and it was pulled down last year, and one was supposed to be constructed in earnest. There is an amount of money, about 68 million euro involved. Can you also update Ghanaians on the status of that?
I haven't been to the site for the last 2 or 3 months, but what I know and report on my desk is the fact that that project is ongoing. We passed through Parliament and money has been secured. If there are problems, there may be administrative hiccups, but I will follow up to see when I get a note how quickly that will spring up. But I know they started work there before even Christmas. Thank you.
Yes. Yes. As the chief advisor to the president in matters of health, what is your